Hi, I'm Carey Campbell and I'm the Clinical Director for Orion Health. I work in both Australia and New Zealand, but also globally with our clinical governance group across the globe. I'm a registered nurse and very proud that I've just also, not only a New Zealand registered nurse, I've just become an Australian registered nurse as well. And also I've just become a fellow of the Australian Institute of Digital Health.
Amazing. So many letters at the end of your name.
Oh, I know, far too many, far too many.
But it's great to be able to catch up again. It's been a little bit since we've talked on the podcast. There is an episode for people to jump in and learn a little bit more. Hey, you've been here at HIC. It's been a busy couple of days and I believe over the weekend too. So talk to me about what you've been doing here at HIC.
Sure. So I arrived on Friday, actually. I was honoured to be asked to be a keynote speaker for the Nursing and Midwifery Day. And really honoured because as a registered nurse, I really want to amplify the voice of nurses and midwives in digital health, because quite often we're the forgotten commodity there, and we're really important. So it was really good to be at that day. It was so much fun. I was speaking in the section around data and analytics and the use of data. And I took a little bit of a different slant on that because quite a lot, I've seen in Australia, but also in New Zealand, a lot of health data is still on paper. And so there's the challenge in using data and analytics when the data's still on paper. So I talked about that a bit, about the metrics and how important they are for improving patient care. And then talked around, hey, but we've got to move to having our data digitised. Yeah.
Super, but there's not much digital you can do with a bit of paper, and that's right. So that's important, and it's interesting from the nursing perspective too. I think you're right that there's a lot of doing to be done, and there are often the nurse capability of. I find that got a lot of capable nurses, particularly even in clinical settings. Even if we're not talking about digital, it's so much more. I think that we can be not that nurses need to work harder. I don't think we can do that, but that more effectively, I think that can then really start to address some of these issues that we talk about in the first place. And we've got an underutilized capability within the nursing function that it's great to spot that, shine that spotlight on.
Yeah.
So then, but I know you've done other things as well here at HIC.
Well, I did do a lightning talk. Now, a lightning talk is a little 5-minute talk, and I first experienced those when I went to Agile Australia last year, and I was a speaker there, but I went to these things called lightning talks, and it's a group of, they group little 5-minute talks together, and they're really cool. So I thought, I'm going to give this a go. So I put in an abstract. It was a little bit tongue-in-cheek. I sort of thought I'll stick with my digital transformation and how to succeed, but I flipped it on its head and I said, how to fail spectacularly. And I did sort of have a bit of a disclaimer to start with, saying, I might really annoy some people with this, but everyone stayed and everybody laughed.
Yeah, nice.
And it was really good. I started with Ed Sheeran, actually. Ed Sheeran talks about how people don't talk about failure, and that he said he learned everything from failure. And when I actually saw clips of him as a youngster busking, because he showed them, he wasn't very good. And now he's a very successful man.
Yes.
So he talked about this. So I started off with that and then talked about my 5 ways to fail spectacularly. And one of them was do not involve clinicians, in digital health. Don't involve nurses, whatever you do. They're far too practical. So you get the gist of it. Yeah. And then finished off with my favourite leadership guru, Ted Lasso, who said, change is a lot like riding a horse. If you're comfortable while you're doing it, you're probably doing it wrong. So, it was a light-hearted 5 minutes, because I timed it many times to make sure it was only 5 minutes. But as I left, someone said, I just laughed through that, but I got some good messages. So I think there's a real thing for these lightning talks. We should do more of them.
I think there's so much I resonate with there in terms of storytelling, in terms of being able to use different methods of sharing important information, which I know would resonate. Those topics that you talked about would are front of mind wherever you are here at HIC, because we've got a lot of change to do, a lot of implementation, a lot of cool things to implement. So that's great. So hopefully you've had some time to check out some sessions and have some chats and sing a few songs with Paris as well. But
yes, definitely singing the songs. That was great. And people are still talking about it in our pink suits.
Yeah, we don't have time for it right now, but what we do have time for is to understand are there any sessions or topics or themes or currents or threads that you have noticed coming from HIC that have really stuck with you?
Yeah, well, certainly there's been a lot of talk about AI, right? So a lot of those, a lot of practical sessions around those. But one that really grabbed me right at the beginning, which was one of the opening keynotes from Dr. Claire Sullivan, was around looking at the ROI, or the return on investment, for putting in an electronic patient record. And I read a paper that she was co-author of last year, and I used it in a talk because what she did, and it really resonated with me as a clinician, is that she linked that, or they, the group, it wasn't just her, but she was presenting today, with the quadruple aim. And I talk about the quintuple aim with equity as well there, because the quadruple aim is one that is a gauge of the effectiveness of a healthcare system, and it's globally accepted as that. And so when you link an EMR and the outcomes of an EMR to the quadruple or quintuple aim, you're not just looking at cost and what are the dollar savings. You're looking at all of those other aspects of patient experience, clinician experience, outcomes, health outcomes, and the fifth one, if you use the quintuple aim, equity. So it's not just the dollars. And she also talked around the horizons, that it's not this short term. Looking at the 10-year horizon, then you're really going to get the benefits. So for me, it really resonates with me.
I think that, what would you say there, it's kind of like investing in a school or a highway. It's an asset. It's not going to generate revenue in itself, but you're then investing in that longer term capability to be able to then do a lot more.
Well, it's a little bit like nursing, really. Nursing, they talk about nursing being the largest cost. But actually, aren't we an investment?
Yeah.